Welcome to Patients at Risk, a discussion of the dangers that patients face when physicians are replaced with non-physician practitioners. I'm your host, Dr. Rebecca Bernard, and I am joined by my co-host and the co-author of the book, Patients at Risk, The Rise of the Nurse Practitioner and Physician Assistant in Healthcare, Dr. Narana Lajba.
Good evening.
One topic that gets women physicians fired up like no other is a discussion of gender issues in medicine. While medical school classes are currently made up of about 50% women, women doctors are still a significant minority in medical practice today. And women doctors face serious inequities still due to our gender. One of the biggest challenges that women must face is a decision if or when to have children because of the intense and lengthy educational training processes that we go through. So there was a recent post that a nurse practitioner put up that she reported that she was feeling really guilty because she was spending so much time away from her children while on clinical rotations. And this post created a lot of controversy among women physicians. Some of the women doctors said that the number of clinical hours the nurse practitioner student was complaining about was really just a fraction of what they had to go through. And then other women physicians said, well, hey, maybe no women clinicians of any kind should have to feel guilty about balancing children and education. So we're here to talk about some of these nuances with my guests, Dr. Sonal Patel and Dr. JouJou Hanna, and welcome both of you. And Sonal, let's start with you. Tell our audience a little bit about yourself.
Hi, well, first of all, thank you. This is an amazing platform to discuss this. I am a product of two physicians as well. And so my mom and my dad, and they were foreign medical graduates. So that means they had to they did their stuff in India. We actually traveled a lot when I was young. And so I moved here when I was 10. And then my mom, so we're going to focus on my mom. My dad had to make those decisions too, but particularly my mom now, who had a 9-year-old and a 3-year-old, had to redo at that point in time, they had to take like the TOEFL exam, qualifying that they knew English, and then USMLE and all of that lovely jazz. And so she actually had to make a choice. She's OBGYN trained, but the residency that was in Omaha, Nebraska, that's where I grew up, was only in family practice. And so her difficult choice was like, okay, do I leave my kids to go to Columbia to do 3 years of OB or 4 years of OB, or do I stay in Omaha, Nebraska? And she chose to stay in Omaha. She did family practice, and through that, she was able to do some of her OB. But since she was an OB, American OB doctor, when she had to do C-sections and stuff like that, she had to have another physician there. And so she had a lot of challenges that way. And she was most experienced one because, she's done it for so long. My story was, I knew I wanted to be a physician, despite the fact of all the hours. I mean, I remember going to, when my parents were on service and going to the cafeteria and thought it was like such a cool thing that I got to eat at the cafeteria. It's like my mom was on call, she'd come down, but we'd eat at the cafeteria. And that was like the highlight. I always knew I wanted to be a physician. I am raising 4 kids with my husband, who's also a trauma orthopedic physician. And I'm a pediatrician. I did a NICU fellowship. And then fast forward, I really changed and pivoted. And now I'm actually doing home health services. But I was a NICU doc for 7.5 years before I pivoted. And there was a lot of balancing that happened. I had kids in residency, I had kids in fellowship, and so I think you've seen it.
You are definitely perfectly positioned to discuss these difficulties. What about you, JouJou?
Hi, yes. Thank you for having me as well. This is exciting. I've never done anything like this before. Long story. I mean, I am a little different. I'm like first generation born here and the first doctor in my family. So I have like 50 first cousins, and my parents came to this country, and it's like the true American dream. And I had no one helping me how to even go to med school or what to even do or what that was like. And so I had to figure it all out for myself, which was really cool. I wasn't one of those people that always thought I wanted to be a doctor. Like I'm a pediatrician as well. And I always knew I wanted to work with children. So I thought I'd be a teacher like my mom or social work or something. But I was in this pretty bad car accident when I was 17, and I had the most amazing, I have all these scars on my arm, like amazing plastic surgeon who kind of encouraged me it was a guy, to be like, don't, you should be a doctor. And I was like, could I be a doctor? And so I always liked science and I just loved it. And so that was just kind of, and I went that route, and of course, hard work, and became a physician. And then I was also one of those, I didn't settle down until I was older. And so when I was in med school and residency, it was on my own. And I used to look at people in med school and go, I don't even understand how you're married. How do you have kids? I can't even do my laundry. I can't even feed my cat. Like, I didn't understand. So that was like, holy moly, like, this is like, you have to be able to balance life. And then as a resident, just seeing some of my awesome girl pediatric, like, they're pregnant running down the hallways, and I was just like, this is awesome. And I always wanted to be a mom and have kids, but I didn't know if that would happen. But I eventually got married, came back home, and I eventually had a kid. And it was one of that dichotomy things where, like, I'm working in the ER trying to save children's lives, and I'm worried about my own child at home. And little by little, I had to cut back hours. I was like, if I cut back hours, I can be there more home for him. Maybe this is my fault, and this and that. And everything I did was like, how do these moms have kids? Like, how do they, supportive, and who picks them up and who does this? It's like, I feel like I'm working to pay for daycare and I'm missing out on time. And I went from ER to urgent care to cut down hours. And then I just went to primary care, and I think it's worse. And so I don't know, I can't take my son to school, and now I'm a single mom, and I can't pick him up, and it's been horrible. And so I finally actually just quit my job again, and going back to urgent care for more shift work, so where I can work when my ex has my son. And so, and in those process, I've seen other, like, we could talk about nurse practitioners too. It's like,
wow, that is such a balance that you're going through, and a really important perspective. So I want to get more into that. Before we do, Naran, talk about you. You also have 4 kids.
I do. And what I was going to say, without even talking too much about myself, because my story is very similar to both of the other pediatricians also who happen to be on this show with me. And I think I'm hearing that I think all of our parents were immigrants. Is that correct?
That's pretty
Yeah. So as was my dad, he was an FMG as well. And for those listening, if they don't know about foreign medical graduates, they were educated 6 years doing basic science and anatomy and all these really, in fact, a lot of people that are foreign medical graduates, especially from India, the Middle East, and a lot of Asia, come in with more education than we have here in the US. And so then they've also done their residency training, and they've been out and practice a lot of times. So when they come here, because they speak a different language or they're from a different country, as dumb as that sounds, to be uniform, though, the United States requires them. It used to be 1 year of internship. That was my dad. And then he was a chief resident in New York after his 1 year. And then I'm not sure what Sonal's, parents had to do, but they have to like retrain. And so not only are they doing all the years we did, but then they're retraining so that they can practice in the United States. And a lot of FMG physicians have to switch specialties as a result of that and do a whole nother residency. So I wanted that one thing really clear, that there's extra training that they have to go through. And then, I think I was the same as far as waiting to have kids. I got married at 32 and I had to bang out kids in 4 years, 5 years, essentially. And that's pretty much what we did. And so I had 4 kids, 4 and under at one point. I had a 4-year-old, a 3-year-old, an 18-month-old, and then a newborn baby. And so I love kids. I enjoy kids. I wanted to have kids. But you sort of postpone your childbearing years. And I think what bothered a lot of us about that post was the person that was doing nurse practitioner school was complaining about doing 240 hours in 14 weeks. And that breaks down to about 17 hours per week. And I think, I trained, I know Rebecca or Dr. Bernard also trained under the old residency hours, right? So we were in, well over there's no limitation. We did 36-hour shifts at least twice a week. And then, we would stay all day. There was no max on the hours we could be there, oftentimes 36 hours plus or more in a shift. So, she's complaining about half of what we would do in one day. And I'm sort of sitting here thinking, you have no idea what we had to go through. And the shame is, if we had to work 17 clinical hours a week and do a little studying, I think we'd manage our kids just fine. So I think that's why it set off so many women in our group.
I think you're right. And, I'll just share just briefly my story. I'm the only non-pediatrician here. I'm a family physician and also non-immigrant parents. Both my parents were nurses, actually registered nurses. I was really interested in medicine because they would always talk about the things that they saw. My dad was an ER nurse and my mom worked in a nursing home. So I was really fascinated by that. But actually, in my situation is a little more similar to JouJou in that I got married at about 30. I didn't really know if I wanted to have kids. I'm the oldest of 4 siblings, and I did a lot of that child rearing because my mom was unwell when I was a kid. And so I thought, do I really even want to have kids? And when I was about 35 and I just didn't get pregnant, I went to talk to the fertility doctor just to get some information. And I went in there and I said, well, I'm not really sure if I want to have a baby. And I'm sure you hear that all the time. And he looked at me and he said, no, I never hear that. People come here because they want to have a baby. And I said, okay. So I realized that unfortunately I didn't pursue that avenue because I ended up getting divorced. That was not the right person for me either. I'm remarried. And I think, wow, I would have had a child with that person for the rest of my life. And that is, as JouJou, I think, can attest, it's just another thing that we have to deal with. And I talk to a lot of women doctors that are now single parents or, struggling with some marital things. So Sonal, you have a supportive husband who is also a physician. Do you have anyone else that helps you, or how do you manage the child rearing with your job as a physician?
So luckily for me right now, last year we finally did not need a nanny. Like it was like groundbreaking because my kids now range from 7 to 16. And I think there's a shift in that. One of the things I learned early on was the fact that when I started the NICU and my new job, a lot of nurses around me were getting a divorce. And I was like, wait, why are you guys getting divorces and stuff like that? And they said that they kept putting themselves on the back burner. And if the only advice they would have given me is to spend the money where I needed it in order to fulfill me. We're 2 household income physicians. Yes, we have loans. Yes, we have all of that stuff, but everything is temporary. So having a nanny is temporary. Spending X amount of money is temporary. Because at the end of the day, I tried being a stay-at-home mom and I completely failed at it. I'll just have to say that because I needed that structure for myself to be a good mom to my kids. And I think realizing that and allowing myself to be like, my identity is the fact that I'm a physician and that is my identity. And I'm going to value that. And so listening to them and getting that piece of advice was amazing to be like, no, you know what? Like my husband has though he's a trauma ortho, he has a very kind of a doable schedule. He's on call Thursday nights and he's on call weekends that we're known. We had to kind of rearrange that, but they were like, you know what? If you need to go out Thursday night with your friends and you wanted to do that, pay for it. And I was like, that was a really good piece of advice that I got very early on.
That sounds like good advice. Now, JouJou, what about you? Your situation is really unique and it sounds, particularly challenging. So have you learned anything that's helped you make it easier, or is it just sort of the way it is?
Survival mode every day. I cry a lot sometimes, but it's kind of same thing that Dr. Patel just said. It's like, I felt like I was like, I don't know if you can swear on this show or not, like half doctor, half mom. Like I wasn't like I felt like I was half-assing at both of it, but trying really hard at both of it. Right. And so, I mean, having a partner doing it, I'm sure is just it was hard, but doing it on my own it's really, really, really hard. And so kind of talk a little, like my parents are not in medical field at all. So but my mom worked, like she was a teacher. And all I can say is I always feel like a failure because I'm like, my mom worked. She had a fresh dinner every single day. She made my lunch, you know what I mean? But she worked. It's just like, how the heck did my mom do that? And, survive, like be the best mother in the world. And I feel like a terrible mom, but, and I know I'm doing the best that I can, but it's gone in phases. I have wonderful friends and family. I've counted on up until now, the past like 6 months, I've had to drop off my son in the morning at different people's houses every morning saying, hey, can you take him to school? Can you take him to school this week? Hey, can you take him to school this week? And then And then I had a nanny for a while, which was wonderful. She was amazing, but she got pregnant and had a baby. And I was like, but I was so happy she did. But at the same time too, it's hard to trust people to come into my home and the interviewing process and all that. And I was like, and my son has gone through a lot of changes and I just didn't want to keep introducing strangers to his life. And so I had to make the decision of and I cannot be a stay-at-home mom either. I was like, I didn't work this hard to just stay at home. And I think being a stay-at-home mom is probably the hardest job in the world. It's hard, but I want to do both. Like, I want to be a good mom and I want to work really hard. I didn't get this degree for any reason, and I still have loans to pay off, and I still have this, and kind of the same things. Like I'm paying for it. Like I pay for aftercare or I pay for daycare. And so but it's not, I'm a single mom pediatrician. I don't make a lot of money and I have a lot of things that I have to pay for. And so I can't just spend the money all the time. It doesn't work like that. And then at the same time too, I'm old fashioned. I want to help take care of my parents. I want to do all these things that, I wouldn't be here if it wasn't for them. So, but that's why I had to make the decision to quit another job. And, yes, I might not have a social life because I'm going to be working the days that my son is with my ex. So I will either be with my son or I'll be working.
That's sort of what I wanted to ask both of you about, essentially how the pandemic affected you. And the reason I'm asking is this is not just in healthcare, right? So the pandemic pushed so many women back into the home because we keep talking about balance. And I find it fascinating. Men balance, like, drinking, well, this is terrible, drinking beer on Thursday with their buddies, right? With like the football game, with like come home and eat dinner. And I know that's a stereotype. So I'm sort of doing that on purpose in a way, because men really weren't pushed back into the home. They definitely did some more education, probably with their kids at home. But really women were sort of broadsided by the pandemic, because we do always balance, right? And then it's sort of the pandemic unbalanced us. And so I guess what I'd like to hear from both of you is, how did you find a balance? Or if you didn't find a balance, how have you kind of sort of recovered or made it work during that time? Because, all our kids were doing school at home.
I think for me, it's cultural also. There's always this the Indian and Asian culture really promote that everything goes on the woman. So despite the fact that in residency, we were working the same hours, I have a fantastic spouse that super supports me. I could tell you guys incidences of like, we would switch, like Nimesh would take the baby carrier to rounding with him at 5:30 in the morning, surgical rounds, and then would switch with me and I would take him to daycare because someone, but all of that. But at the end of the day, the pandemic was, for me as an Asian, all the responsibility at the end always came to me, like regardless of when we were in training. So it was easier to be like, okay, I'm just going to step in because it's always been like that. And definitely he's done what he's done. Like I was never one of those moms. I learned early on that, I cannot play on 36 hours when I'm on call. So here's baby, bye. And he did a wonderful job of stepping up. But then you kind of, when you get into the swing of it, things, you just kind of go back to your cultural aspect as like, well, we're just going to do it. Honestly, again, I hired one of the teachers and I said, I cannot handle this. And it was me, like I couldn't handle it. That pressure had caused me to not be able to do my job properly. And then I was becoming resentful. But then as a teacher, I was like, okay, well, that's going to be maybe a third of my salary and I want to do this because I need it for my sanity. So I think the pandemic kind of just was like reinforcing the fact that I didn't work this hard for, again, those many years to take a backseat with my career either. So we came together and we're like, we're going to do this. We're going to hire this person to help us out.
What happened with me, I ended up, again, I don't know if it's a blessing or God, how it works for me, but I just happened to have a child that was at that age that was, he was not in public school yet and he was in still daycare. And so, he was in a Montessori daycare and it's a lovely, yes, I paid for it, but they were so amazing. They never shut down during the pandemic. And they actually, in the very beginning, stayed open for essential workers. So I was the person that was leaving my house at 6:30 in the morning, taking him to the daycare. I drive an hour to work every day. I work full-time primary care, get off at 5, drove an hour, get to pick him up at 6:30. and then still have to feed him, bath time, do everything, and do it every, and then I still have like 30 charts to do like every day, right? And so if that Montessori school wasn't open, I don't know what the hell I would have done. I
Well,
just keep
what we're hearing here, our audience is hearing, is this really classic role strain that I'm sure all women that professionals go through, but women doctors really go through, because what we're hearing is that sandwich generation. You're worrying about your parents, you're worrying about your children, and then, oh yeah, guess what? You also have to take care of a bunch of patients, and you're responsible for their lives in a lot of respects. And of course, you're paying back debt, and you have to be potentially the breadwinner. But the other thing that's really unique to women physicians is that women doctors have higher rates of burnout, and there's really good reason for that. In fact, there was a brand new study that just came out. It was so interesting. They showed that women doctors get more portal messages from patients and from staff, even when they control for things like the actual just the types of patients, like not even because they have more women patients. People are more demanding to women doctors. Naran, you're nodding your head about that. What do you have to say?
I'm laughing because, number one, as you know, I'm on paper, so there ain't no portal for me ever.
like I don't paper.
I don't answer emails. I answer phones, and I see patients in the office. But what's funny is, when I first came to town, somebody called me at like midnight. I'll never forget. They called my house. I think it was listed. And what's funny is my dad had taken care of the mom as a child, right? So this is one of those multi-generation that we have in our practice. And he was on second generation. So it was her kids. And I remember like answering the question and then calling my dad and being like, I don't know why she called me instead of you. You know what the answer was? The answer was exactly what you're saying, which is, well, I didn't really want to bother him. And I was like, oh, wow. I mean, and again, this is 20 years ago. I mean, before we had these conversations, it was so funny though, because you're absolutely right. Now it's a little bit flipped. I'm older and been here a long time. And I think everybody knows I'm busy with my kids. So they're a little bit less likely to feel that way. But it was really interesting. It was so like black and white. Here he'd taken care of her as a child, her children as children. They were maybe 5 to 10 age group. And she's calling me because she doesn't want to bug him.
It's very interesting because, they clearly, patients and staff are thinking a little bit harder before they ask the male physician, but they have no problem with bothering women doctors. And I think that's so very interesting. The other thing that studies show is that women talk more to patients. We spend more time on psychosocial issues. We do more preventative care. We potentially have better outcomes, and yet we earn less money compared to men, even when they control for things like working part-time and hours. So what are your thoughts when it comes to like salary gaps and gender inequities?
Oh my God. I think I could fill a whole hour with that. No, definitely. It definitely exists. And I think we're coming to an age where we like not only a sandwich generation, but also in training, we've had role model physicians. Like I remember in the NICU, when I was training down at LSU, 6 of them were women, and we would laugh and we'd be like, oh, six of my attendings. And the head one was a male physician who was the director, but we'd all laugh that he had a wife at home, and we all needed wives at home to do our jobs, but talking to those women, having those women as role models to be like, okay, now I can speak up for myself. So I think there's recognition of it. And there is also people helping us to speak up for ourselves, that we are worth it and our value is worth. And so we are able to negotiate a little bit better. And it's okay to negotiate. I think that's the biggest thing that we fail to realize, that, it is okay to negotiate. You don't have to settle on the first salary.
It's mandatory. In fact, studies show that women are automatically offered like 30% less than men that for the same job. I just say to people, just assume that you should get paid 30% more than what they're offering. And then, aim even higher than that. You must negotiate. I didn't negotiate my first job. No one told me to do it.
Me neither. I just walked in and I was like, oh, I got a job and I'm attending now. And,
Same.
It's part-time and everything's going to be like rainbows and everything. And then you get into the job itself and you're like, I remember we were moving from Boston. So I live in Denver now, my first job. And the person in charge had put myself on call the first day I was there. And I was like, I'm getting to know your system. The first day of my job as a NICU attending, I'm going to be on call. And so I spoke up, and then, yeah, he's like, oh yeah, that's an oversight. We should have put you like in a month on call. But, you know, it was just like, what do you mean? I'm like, I'm just walking into it and I'm going to be on, like, it was just weird.
But, you know, that's a really important point that you made, that you actually stood up and said, wait a minute, this isn't right. I think, you know, a lot of us as women would have just said, okay, you know, being passive. And so I think hearing that story hopefully will inspire other women to say, you know, just speak up and ask, like, wait a minute, is this, you know, maybe that's an unconscious bias that someone that made the schedule did. And it is interesting when you look at employers. I remember once I was at an event and there was a bunch of administrators, and, you know, they never know what to say to you. So they asked me, did I have kids, which I don't think they're even supposed to ask you. And I said, no. And he said, oh, that's great. I'll be able to get more work out of you. And I was like, and at the time I just went, you know, haha. But now that I'm a little older and I know better, I would have said, you know, talking about that is not appropriate, or, you know, something, because studies show that it actually, men do take it well when women, you know, just basically call them out on what they say and let them know that, you know, what they may not even realize, but we do need to start acknowledging those kind of comments, that those are, you know, really not helpful.
And I would also say, you know, to go back to your point about the different pay, you know, the insurance companies, they don't, I think, to my knowledge anyway, they don't pay me less because I'm a woman. You know, I'm in private practice. So whatever the negotiated rate is across our region or our area is what we get paid. And so it's less of an issue in that regard. And so some of this difference in salary and difference in pay is going to be how an employer or hospital, which I've never had one of those, so I can't even go there, but how they value you. And there is that idea that once you have kids or once you have this other stuff, you're not as valuable. And I want to say I'm an employer, right? So I have 5 employees. We made it all the way through the pandemic. I didn't lose anyone. And the majority of my staff do have children. And we really make it a priority for them to get to what they need to get to, right? It's real simple. Say, I've got an appointment for my son or my dentist appointment for my kid. And I'm like, goodbye, see you later. Same for spouses, same for everything else. And what I've noticed is the flexibility that I'm allowed to have, or I allow my employees to have, they often will come in after hours to fix something or make something up, or they just sort of like often go above and beyond. I'm not saying that's why I hire people with children, but again, I'm a pediatric clinic. I want staff who understand children. I want them to understand how kids behave when they're having a bad day, you know, flexibility. And so someone like me, I actually love when my staff have children or are thinking of having children, because we need to teach and we need to model flexibility. And so I would tell you that all of my staff have been with me for a number of years. And I think it's because I treat them well. They treat me great as well. And we're really a functioning team. And so it's a shame that someone says, well, I'll get more work out of you when you don't have kids.
Well, you know, one of the things that's interesting that studies show is that women physicians, when their children are older and no longer require so much attention, women physicians actually catch up to their male peers, like in academics. They actually catch up with publications, and then they outperform the men. So I think part of it's just getting those kids out of that, you know, that young age where they need so much attention. And then, you know, women actually really flourish. And one of the things I'd love to see in medicine is to have opportunities for leadership for women once the kids are a little bit older, and women can start to get more involved in things that they really can't when the kids are so young, unless they have the luxury of having childcare or a family member that helps out.
I think I'll just add for the role modeling part, because in my career, I've seen it a couple of times and I want to highlight it. When I was a 4th year medical student and I had to work at Le Bonheur in Memphis, Le Bonheur actually has a daycare right across the sleeping quarters of residents. And one of the residents was breastfeeding, and she literally went from rounding to be like, okay, I'm just going to go downstairs and breastfeed my baby. And I thought that was like eye-opening. And I was like, oh my God, this institution is supporting this. And then when I moved here in Denver, one of my old-fashioned attending, NICU, PICU attending, he was my boss, and he told me, and I think this is a Midwestern mentality, because in the East Coast, I didn't find this. I was very fortunate to train all over the country. But he told me that when you're on the hospital service, your whole family knows you're on service. You're on NICU service, your whole family knows, and they take a back burner to that. So when you plan your vacations, it should be the opposite, that work takes a back burner to it, that everybody at work knows that you are off and you are, you know, you're on vacation with your family and your family's important. And I think those kind of little role models, and like I said, the nurse is telling me to kind of put myself forward. Going back to the actual OP, that the nurse practitioner who did that, and with the training and stuff like that, at the end of the day, training matters. We all know it. The more experience you get, the more you get in depth with it, the better you're going to perform. And I just felt bad for her because maybe she didn't know that going into it, not knowing, like JouJou had to figure out everything out for herself. I had the privilege of seeing my mom go through it and trying to balance it. And that is medicine. I mean, you do have your sacrifices, and you have to make sacrifices, and you have to balance it. So maybe she just didn't know that it was going to be this hard.
You're so right. You what, guys, this has been such a great conversation, and we're actually out of time. If you'd like to learn more about this topic, we encourage you to get the book, Patients at Risk, The Rise of the Nurse Practitioner and Physician Assistant in Healthcare. It's available at Amazon and at barnesandnoble.com. And if you're a physician and you'd like to join our group, it's called Physicians for Patient Protection. We welcome you. Just visit us at our website, physiciansforpatientprotection.org. Thanks so much, and we'll see you on the next podcast.